We often hear about the harmful effects of cigarettes on the lungs, but few people know that the impact of cigarettes on cardiovascular health is even more dangerous and far-reaching. Each cigarette not only contains thousands of toxic chemicals but also weakens every cell in the body, especially the cardiovascular system. Chest pain, shortness of breath, fatigue, and even swollen legs are all warning signs of the damage that cigarettes cause to your heart. Every year, millions of people around the world suffer from serious cardiovascular diseases, from heart attacks to strokes, just because of the habit of smoking. But the important thing is, it's never too late to change. In this article, we will learn in detail about how cigarettes destroy cardiovascular health and measures to help protect the heart from this risk. How smoking affects the heart and blood vessels. 1. Carbon monoxide and oxygen deprivation. When a person smokes, they inhale carbon monoxide, a toxic gas that binds to hemoglobin in the blood more easily than oxygen. This reduces the blood's ability to carry oxygen to vital organs, including the heart. Over time, this oxygen deprivation puts a strain on the heart, forcing it to work harder to pump oxygen-rich blood. According to Dr. Michael A. G. M. Lichtenstein, a renowned cardiologist at Harvard Medical School, this increased workload on the heart can lead to heart enlargement and, eventually, heart failure. Even in the early stages of smoking, carbon monoxide exposure can cause shortness of breath, chest pain, and other symptoms of cardiovascular stress. 2. Nicotine and increased heart rate and blood pressure. Nicotine, the addictive substance in cigarettes, triggers the release of adrenaline, which leads to an increase in heart rate and blood pressure. Dr. Jennifer P. Harris, a leading cardiologist at the Mayo Clinic, explains that these short-term spikes in heart rate and blood pressure put a significant strain on the cardiovascular system. Chronic exposure to nicotine leads to sustained high blood pressure, hypertension, which increases the risk of heart disease. Harris's research highlights how nicotine also thickens the blood, making it more prone to clotting, which can block arteries and cause heart attacks and strokes. 3. Damage to the endothelium and atherosclerosis. Smoking causes damage to the endothelium, the inner lining of blood vessels. The endothelium plays a crucial role in regulating blood flow and preventing clotting. According to Dr. John R. G. Taylor, a vascular specialist at the Cleveland Clinic, the chemicals in tobacco smoke impair the function of the endothelium, leading to inflammation and thickening of the blood vessel walls. This process, known as atherosclerosis, accelerates plaque buildup in the arteries, restricting blood flow to vital organs. As a result, the heart and other organs receive less oxygen and nutrients, increasing the risk of heart attacks, strokes, and other cardiovascular complications. Taylor's research shows that this damage is particularly severe in smokers, who experience a faster progression of atherosclerosis compared to non-smokers. 4. Platelet aggregation and blood clot formation. Smoking also increases platelet aggregation, meaning the platelets in the blood become stickier and more likely to form clots. This increases the risk of clot-related events such as heart attacks and strokes. Dr. Lee M.W. Hsu, a specialist in cardiovascular thrombosis at the University of California, highlights that smoking accelerates the clotting process by increasing levels of fibrinogen, a protein involved in clot formation. This causes blood clots to form more easily, even in individuals who may not have significant plaque buildup in their arteries. These blood clots can travel to the heart or brain, causing a blockage that leads to a heart attack or stroke. Heart diseases linked to smoking. 1. Coronary artery disease, CAD. One of the most common and severe consequences of smoking is coronary artery disease, CAD, a condition where plaque accumulates in the coronary arteries, reducing blood flow to the heart muscle. Dr. William P. McEvoy, a cardiologist at the Mayo Clinic, states that smoking accelerates the development of CAD by increasing plaque buildup and promoting atherosclerosis. As the coronary arteries narrow, the heart is deprived of oxygen-rich blood, leading to chest pain, angina, and an increased risk of heart attacks. McEvoy's studies show that smoking raises levels of LDL, bad cholesterol, and reduces HDL, good cholesterol, creating an environment that promotes plaque formation and accelerates the progression of CAD. 2. Myocardial infarction, heart attack. Smoking is a major contributor to myocardial infarction, commonly known as a heart attack. Dr. Christine A. L. Thompson, a heart disease expert at Johns Hopkins University, explains that smoking increases the likelihood of blood clots forming in the coronary arteries, which can obstruct blood flow to the heart. This blockage causes the heart muscle to lose its oxygen supply, resulting in tissue death. Thompson's research has shown that smoking-induced damage to the arteries, combined with the increased tendency for clot formation, is a leading cause of heart attacks. 3. Stroke. The relationship between smoking and stroke is similarly concerning. Smoking increases the risk of both ischemic stroke, caused by a blockage in a blood vessel in the brain, and hemorrhagic stroke, caused by bleeding in the brain. Dr. Edward D. Jackson, a stroke specialist at the University of Washington, explains that smoking stiffens the blood vessels, making them more prone to rupture. The plaque buildup caused by smoking not only affects the heart but also the arteries in the brain, significantly increasing the risk of stroke. Jackson's studies have shown that smokers are at a much higher risk of experiencing a stroke than non-smokers. Early warning signs of heart problems due to smoking. 1. Chest pain, angina. One of the earliest signs of heart disease in smokers is chest pain, often caused by reduced blood flow to the heart muscle due to narrowed arteries. Angina is typically triggered by physical exertion or emotional stress and is a warning sign that the heart is not getting enough oxygen. 2. Shortness of breath. Smokers may experience shortness of breath due to decreased oxygen levels in the blood and the reduced capacity of the heart to pump oxygen to the body. This symptom can become more pronounced during physical activity or exertion. 3. Fatigue. Chronic fatigue is another sign of cardiovascular problems caused by smoking. When the heart is unable to circulate oxygen-rich blood efficiently, the body's tissues receive less oxygen, leading to feelings of tiredness and low energy. 4. Swelling in the legs and feet, edema. Smokers may develop swelling in the lower legs, ankles, and feet as a result of poor circulation and heart failure. This occurs when the heart is no longer able to pump blood efficiently, causing fluid to accumulate in the lower extremities. The importance of quitting smoking to protect your heart. Quitting smoking is the most effective way to protect your heart and overall cardiovascular health. The damage caused by smoking can be reversed to some extent, even for individuals who have smoked for many years. Dr. McEvoy suggests that smokers who quit experience immediate benefits, including a drop in blood pressure and improved circulation. Over time, the risk of heart attack and stroke decreases significantly. Key steps to protect your heart after quitting smoking. Quit smoking. The sooner you quit, the sooner your heart and blood vessels can begin to heal. Even a few months of being smoke-free can reduce your risk of cardiovascular disease. Exercise regularly. Physical activity strengthens the heart, improves circulation, and helps to manage weight and blood pressure, further reducing the risk of heart disease. Adopt a heart-healthy diet. Eating a balanced diet rich in fruits, vegetables, whole grains, and healthy fats supports cardiovascular health and helps lower cholesterol levels. Monitor your health. Regular checkups and screenings are important for detecting early signs of heart disease. Blood pressure, cholesterol levels, and overall heart health should be monitored regularly by a healthcare provider. The harmful effects of tobacco on cardiovascular health are undeniable and are becoming increasingly clear through research by experts. Its negative effects not only make the heart work harder but also increase the risk of dangerous diseases such as myocardial infarction, stroke, or heart failure. However, by quitting smoking and adopting a healthy lifestyle, you can completely save your heart and stop this destructive process. Take action today to protect your health and that of your loved ones. Whether you have smoked for many years or are just starting out, every day you do not smoke is a day you are saving your heart. Please share this article with those around you, so that they are aware of the dangers and together build a healthy, smoke-free life. Your heart deserves care and love.